You must pardon me while my inbred neighbors are doing like donuts out in the street. Fuck these people. Fuck them. So 2003 was a rough time. I started my internship and had some problems. I was a bit racist for a few years, made some mistakes with AOL, girls, and all that. And notably, besides graduating, where did my degree to go to get my bachelor's degree? What was that all about? You'll pardon me while I'm. This is all my medication here. I got my surgery about 20 years ago. So, synovectomy. When we talk about synovectomy, of course, this is a joint saving surgery. So this is outpatient surgery, and I got this in December of 2003. And you can see it's about when you've got nothing in there but rocks, okay? No tissue. It's just your joints. So here we have, this is the emicizumab. This is the Hemlibra. Uh, I'm going to put, I'm not going to do this all. I'm just going to set this up, and that'll be the end of the video, okay? You're not going to hear me or see me do this. But I am going to set this up, and then that'll be it. So here I have like 255 here for my left side of my stomach, and then 150 for my right side. So I'm going to open these up, and I'll talk about so I've been born with hemophilia severe type A. I've had it for almost half a century. There are 16,000 of us in the United States who have severe, 40,000 with hemophilia in general, whether it's recessive or dominant, type B, type A, factor 8 deficiency, factor 10. I am factor 8. Um, so this is my medication. Originally, I had human blood uh, transferable, like plasma kind of factor, right? And then after the lawsuits with my family against the pharmaceuticals for AIDS viruses and such, they stopped using human blood. They used alligator blood, and I'm not sure what other blood they're using now. So here is my medication. This is the Hemlibra. Not a very interesting topic, but so I've had my dad would not infuse me all the time, not prophylactically, but uh, whenever I had a bleed. And I don't know if I told you this story, but I used to run 3 laps in 2 minutes when I started my senior year of high school. I could run. Okay, this is the 105. 105 stuff right here. Okay, this is the other part. And I need my syringes. So, not to be confused with the hypos, okay? This is stuff that you have to assemble, okay? So I have to assemble this onto this. And my knee grew to the size of a fucking grapefruit. So I was in enormous pain. I was in severe pain. But back then, when I was 18, 19, 20, from 18 to 25, I could run pretty good. I was very good at running. I loved running. I mean, I loved it so much. You know what I mean? Like now, I have a Razor scooter, or actually, it's the other one, the Mongolian, or whatever it's called, the Marigold, or whatever it is. It's the other scooter. So I got to put these in. I got to take these off. Always make sure everything is sterile as best as possible. So we have the two without the caps on. And so I could run, but it was difficult because as I was running, I mean, I had different primary care physicians, and one of them suggested that my dad would infuse me every day for about a month, and I wouldn't have any problems of bleeds. And at the time my dad was infusing me every day for a month, according to my Dr. Hugh was my doctor, and I wore these like tight leather, like kind of slip-on boots, uh, and it had like the boot, like the bottom of a boot, no grip. It wasn't the kind that gripped. It wasn't like a sneaker bottom, rubber bottom. These were like leather soles. And try to run or walk very fast on a rain puddle with those things. And I slipped and fell on my back. And I undid 30 days of infusions. And the pain would return up my left knee would swell up. And I went from one primary care physician to another because I think my mom didn't like the guy very much. Um, I guess I guess it's positive racism. Uh, that is what it looks like. To assume that just because somebody is Asian or somebody of age, that maybe that they know what they're doing. So these are the smaller needles. So because this one's like a horse needle, that is not going into my stomach. I'm not doing harakiri on this channel. Uh, we're going to use these small ones. It's kind of similar to when diabetics take needles. Okay, so I when my dad used to infuse me, and when I self infused, but I would infuse. You see these veins here? They always say how good my veins are because um, more in the left than the right wrist. Because obviously, if I'm left-handed more, right? So my dad passed away in '02, and I graduated from Cal State University. Went through the internships, went through the stupid chats and talking to weird people online, and then had that run in with a criminal street gang in Hollywood. And then eventually, push came to shove, and I went to a new primary care physician to get the synovectomy. Now, the first time I ever had surgery was in '99 for my appendix. And that was like, I had to go deep under. So we tossed this one aside. And it was fine for that time. But, um, and I remember, I'll talk about that story next year. But it was like life and death for me. So this one's done. So I go to the other one. And this is just the one box, the 150. So I would be there for one day. My doctor, who was my actually, I had two like, so I had my primary care physician, but she's more of a clinic doctor, right? She's a hematologist. But the one that operated on me is the one whose father founded the hospital, and he's sort of the director, right? So he's the surgeon who operated on my knee, and the logic of what I showed you in the picture was that the two bones of the knee are rubbing together. There's no more tissue. So they had to figure out a way to get rid of the iron that was in there. Because if your blood is unchecked, it could turn into iron. Okay? So they cleaned it out. And after about a month or two of being in a cast, being in braces, I came to the sad realization that I could no longer run. I could walk pretty fast, but I could no longer run. And later on, I self infused. So I would do my own, like I'm doing right now. But I used long cables with the butterfly needles and stuff. And I used to use tourniquets, like you see here, this tourniquet that you see here. So, like I would use tourniquets. And so now, because I'm infusing by stomach, I don't need to tourniquet anything. So I have to actually get the needle on. So for the last 20 years, I've had like restrictions on my knee. But since '04, I think that's when I self-infused. Now, as of this video, can I get this off? Jesus. Almost ready to go. As of this video, there has not been a cure yet for hemophilia, and I hope there will be, because it's ridiculous that we've been waiting this long without a cure. I came close to getting the damn cure, and you know what happened? They tossed me on my ass, saying my immunity was too high. We had a concierge. I was ready to go to Tejas, okay, to go to Texas and get that cure, and then be part of a case study. I was fucking close. I was fucking the cure right up the ass, but of course they had to give me an excuse. I was to be patient zero for this cure. And no, that's not how my life works. I get fucked up the ass. So, yeah, I was pretty upset. I think my doctor was too, but, I just like it when people are looking out for me and things somehow work out in the end. That has never been my life. So, as of right now, I am taking this stuff. I wish there could be a pill or capsule, where you just take that instead. But that's not how it goes. It's just I had the cure for hepatitis C in 2014. Okay, so these are my two. They're going to go right into my stomach. My 2 injections. So that's it. So hopefully you like this video. What I learned, I guess, is that I didn't start exercising until after I moved into this house, and then I just started exercising. So I feel like running, but I know I'm not going to fucking run for shit. I'm not going to run for shit. I can sprint, but I can't sprint for very long, and it's hard. So I wear better shoes. I use a scooter. I try to do things better and preserve my feet. But if I walk around too much, I'm going to be hobbling. So there are times where I walk too much and I'm on crutches for a day or two, and then I recover. That's just how my feet are. So if any of you are going for surgery anytime soon, I wish you the best of luck. Hopefully it's outpatient and not inpatient. And yeah, so until next time, take a shot or two. And here's to your health.